If you're just joining us, we reported big breaking news at the top of the show. Starting Monday, Governor Evers is opening up COVID-19 vaccine eligibility to everyone in Wisconsin 16 and up.
The news comes as more than 1 million people in Wisconsin are fully vaccinated against COVID-19.
Joining us today is UW Health Chief Quality Officer Dr. Jeff Potoff. Happy National Doctor Day, Dr. Potoff.
Thanks, Susan. Appreciate that.
We're so grateful for all of your guidance this past year. So this is big news from the governor. And now the question is going to be, how is this going to work? Because a lot of adults are still on waiting lists, still waiting to get their second vaccine. So will we have enough supply to vaccinate everyone 16 and up?
You know, I think what you'll see is some regional variation. You're going to see some vaccinators really not have a supply. They're going to have full vaccination lists, and it's going to be hard to get a vaccine from them. But then other vaccinators are going to have vaccine. They are going to be able to get people in. And I think, you know, with essentially anyone who wants a vaccine, able to get a vaccine, it's important for folks to call around and try to find those spots that are going to have vaccine available. Now, as we get more vaccine in the state, that problem will go away. But, you know, if you're eligible today, I'd make that appointment, you know, this week yet before you're competing with others on Monday.
So how quickly do you think we'll be able to see some progress against the virus? I mean, I know it depends on supply, but let's just pretend that we've got the supply and people are going to get those shots.
Yeah, you know, it's incremental progress. So, you know, even though we talk about herd immunity, 70, 80%, to really make things go to normal, even with less than that, you start seeing the virus have a bit harder time spreading. And I think, you know, one of the good things we have going on right now is a lot of our 65 plus, those individuals who most at risk for severe disease are vaccinated. That should give us a leg up, even if we do see the virus start to come back or make a surge.
Well, we're certainly not across the finish line yet. The director of the CDC yesterday dropped the script. She looked right into the camera and she said she feels a sense of impending doom and she's scared. For those of you who didn't see what Dr. Rochelle Walensky said, let's take a look at it, and then I'll ask you a question, Dr. Potoff, when we come back.
I'm going to pause here. I'm going to lose the script, and I'm going to reflect on the recurring feeling I have of impending doom. We have so much to look forward to, so much promise and potential of where we are, and so much reason for hope. But right now, I'm scared.
Dr. Potoff, what is your reaction to that? Do you agree?
You know, I think there are some things that are happening that have us a bit worried. And, you know, what we've seen through this pandemic is when we are blessed with good news, we tend to move a bit aggressively on loosening restrictions. And I understand why people would want to do that. But what we've seen both here in the U.S. and other countries is when we move a bit too quickly to get back to normal, we give the virus a chance to make a comeback. And unfortunately, we're starting to see that. Not so much in Wisconsin yet, although there are some counties, our percent positive rate is slightly increased. But if you look to a nearby neighbor, Michigan, they're struggling right now with what is some people are calling a fourth wave of COVID-19. So it's just so important to remember that even with all the good news and all this news around vaccination and cases being low, COVID-19 is still out there, and it's still possible that it could make a comeback, which I don't think any of us want to see right now. So mask up, keep your distance, and let everyone get vaccinated.
Dr. Potoff, quick question. Are you worried about spring breakers?
You know, I do have some concern with spring breakers. You know, one, the areas that people go to for spring break, namely Florida and Texas, have some of the most lenient restrictions right now. They also have some of the highest numbers of the B117 variant. It's possible that those young people, if they do partake in activities that put them at risk of getting the virus, could bring it back to their communities that don't have high levels of that variant and touch off some hot spots. So it's important that we're all very careful with our mitigation efforts, because we just don't know what the effect of some of those spring breakers will have on our local communities.
Do you think it's a result of relaxed rules and things opening up, or do you think the variants are getting the upper hand on us?
You know, I think it's a combination of all those things. Clearly, the variants are more contagious, but when we loosen restrictions, we make it easier for them to spread. And then thirdly, I think, you know, as this pandemic goes on, we're just tired. We have a harder time doing the things that we know we need to do to keep our families safe and our community safe. All those things together do give the virus a chance to make a bit of a comeback.
Yeah, something to think about this Easter weekend, too, if you're planning to gather with people who are unvaccinated. Dr. Potoff, great to see you. Thank you, as always, for your time.
Have a good afternoon.